Hello and welcome. This is Gist Nigeria. Coming up, International Women's Day. We explore stories of cervical cancer survivors and burst myths around the diseases. And internet blackouts. Specialist repair ship fixes transatlantic data cables to keep Africa's internet connectivity running.
My name is Asnama A. Bitrus. Check me out.
The researcher working to address antimicrobial resistance in humans and animals. It's fantastic to have you join us on this episode of Gist Nigeria, brought to you by the BBC and Channels Television. And here we track stories online in the news and dissect them. I am Wale Fakile. Let's kick off with our top story. Cervical cancer is perhaps one of the silent killers in Nigeria. At least half of the women diagnosed do not survive due to late detection. Authorities are vaccinating school children against human papillomavirus, HPV, but the monster still lurks in the dark. In this story, Gist Nigeria's Mercy Frank speaks to survivors, bursts myths around it, and experts offer useful tips that can help you beat the disease. Have a look.
Being diagnosed with stage 2 cervical cancer on the 27th of July 2016 was a turning point in my life.
My wife lost her life because of cervical cancer.
Most ladies will present at what we call stage 4, which is when the cervical cancer has now spread and to other parts of the body. So the chance of that lady being alive in 5 years is less than 20%.
A silent killer, yet preventable.
The HPV vaccine is one of the main strategies to prevent cervical cancer.
As of today, we have vaccinated over 13 million girls in Nigeria.
Cervical cancer is considered a silent epidemic. The World Health Organization reports that in 2022, at least 660,000 women were diagnosed with cervical cancer globally, more than half of whom did not survive, mostly due to late detection. The WHO also reports that the highest rates of cervical cancer incidence and mortality occur in low and middle-income countries like Nigeria. Current estimates indicate that every year, about 15,000 women are diagnosed with cervical cancer in Nigeria, with over 10,000 of them dying. A 2022 data from the World Cancer Research Fund further indicates that Nigeria comes top 7 out of 10 countries with the highest cervical cancer incidences. Out of 10 countries with the highest number of cervical cancer deaths, Nigeria ranks 6. 49-year-old cleric Malam Mujitaba Adam's wife, Rukiat Mujitaba, died 6 hours after her diagnosis following the delivery of their baby. She was 38 years old.
After like 3 to 4 hours, after giving birth, after 4 hours, so I saw her, I saw totally change in her. She can't understand anything. She lose even her memory. She just looking at me and he can't talk. So they decided to call one doctor. When he come, he say, let us go and make some tests for her. After 1 hour, he come to me, he say, we have to remove her uterus. I saw one of them come out and talk to me. Mujitaba, I say, yes, ma. She say, go and see your wife. Everything don't finish. So I enter and I found my wife is dead.
For Franca Eze, it was a close shave with death that she's glad she lives to talk about. The 36-year-old, then mother of 3, chanced upon an early diagnosis that saved her life.
She asked me to remove my own. This I did. I opened my legs and the smell came. And she was like, now human being, they smell like this. Please wear your pants. In 3 years' time, go and repeat the test. What was I to repeat in 3 years' time? I didn't know.
Franca's dissatisfaction with the way she was treated made her more curious.
Eventually, she did the test. She called the 2 other medical people that were with her. They looked at me and they said yes. The point when she said yes was like, what is the yes for? She said, I thought you knew you had cancer. I said, no, I don't have cancer. They invited my husband. They started counseling us. I was doing counseling every week. And they started treatment for me.
Franca, who now spends her time talking to women about cervical cancer, says she's thankful to have a second chance at life.
On the 9th month of my treatment, the matron asked me if I knew I was ovulating. A year later, I became pregnant. So I have a child who is turning 6 next month, and is my miracle baby.
Cancer is when the cells in our body start dividing very quickly and they go out of control and they start forming lumps and masses and then spread to other parts of the body. So with cervical cancer, it's basically when that process starts happening in the female reproductive organ.
Over 90% of cervical cancer is caused by human papillomavirus.
Cancer Council explains that HPV is a common sexually transmitted infection that usually shows no symptom and goes away by itself, but can cause serious illness. HPV is responsible for almost all cases of genital warts and cervical cancer, 90% of anal cancers, 78% of vaginal cancers, 25% of vulvar cancers, 50% of penile cancers, and 60% of cancers at the back of the throat.
This matters for both male and female because, we talk about a woman not having multiple sexual partners. But a woman that has had only one single sexual partner, but the sexual partner has had multiple sexual partners, also still puts the woman at risk.
So the symptoms you can have with cervical cancer are things like bleeding in between your periods, or if you're a lady who's already gone past the menopause and suddenly you start noticing that you're having bleeding. You can have pain on sexual intercourse, for example. Sometimes you can get pain on urination.
And then, of course, if you have continuous non-stop vaginal discharge that goes on for weeks to months, and in some cases, the discharge is really, really foul smelling.
The terrible thing about cervical cancer is that it can be very insidious.
So we see a wide range of symptoms when people present, and it's really, really frustrating and saddening because you know that for them to have presented at this stage, this process started a decade or two before. Cervical cancer is preventable.
Survivors like Franca are proof that one can have a normal life after cervical cancer treatment if diagnosed early.
But if you catch it right at the early stage of the illness, like stage 1, for example, some of these survival rates are above 80%.
Because we know that HPV has to be persistent and has to have caused some sort of abnormality in the cell growth, which takes about 10 to 20 years. We screen so that if there's any of those changes, we pick it early enough.
For many women already affected, there is a huge barrier to treatment: stigma.
Emotional distress hamper recovery. There's a way that both are connected. Now, the patients are receiving treatment for a physical condition, but they go through a lot of emotional experience and reactions to that physical condition. So when someone is receiving treatment for cervical cancer, but the same individual is in a state of distress, it can affect their response to treatment.
A common myth is that cervical cancer is a spiritual attack that requires religious rituals and not medical treatment.
Cervical cancer is mostly caused by human papillomavirus, not witchcraft, not spiritual attack.
A lot of people hide under the quotes of "it's not my portion, I reject it."
And that causes a lot of problems because patients who could have gotten treatment earlier do not get appropriate care. They don't go to the hospitals because they're going to some religious institution to get prayed for.
I used to give advice for anyone who get something like this, let them first go to the hospital.
Another myth is that only women of certain races get cervical cancer.
Cervical cancer is not a white man's disease. It can happen to any woman that is sexually active and exposed to human papillomavirus. Sadly, the worst outcome is seen in countries like ours, low to middle income communities.
One more worrying conspiracy theory is that the HPV vaccine induces sterilization.
No product, no medicine, no product that comes into Nigeria, no vaccine, and the HPV vaccine nonetheless, that is not tested and certified by NAFDAC. But for two things. One is that it is meant for exactly what we said it is meant for, and it's effective against that, which is to prevent infections with human papillomavirus and prevent cervical cancer as extension.
You don't even have to wait till you need to have symptoms for you to see a gynecologist to prevent cervical cancer.
Ladies should actually start getting screened for cervical cancer earlier in life, when they're sort of in their mid-20s or 30s at least. They should start doing their smear tests every 2 to 3 years.
The HPV vaccine it targets people who have not yet gotten very active sexually. So in our setting, that's early adolescence. So the strategy that we took in introducing the vaccine in Nigeria was to first of all do what we called a multi-age cohort campaign, and then move it into the routine immunization program. So multi-age cohort meaning young girls between the ages of 9 to 14.
We have centers where women can go in and get screened for HPV. Introduced and distributed thermal ablation and LEAP devices in our secondary health facilities, that's in our general hospitals, in our zonal hospitals, so that those lesions that are precancerous but are showing a tendency towards developing cancerous lesions can be adequately treated at that level.
For women who struggle to eke out a living, a pap smear could be a distant dream.
These vaccines are expensive. Of course, we would love limitless funds available for the procurement of vaccines so that we don't encounter stockout.
A lot of ladies who are going through cervical cancer would benefit from more support from the men around them.
If you have young doctors within your care, ward children, make sure that they receive the human papillomavirus vaccine.
As the world marks International Women's Day, cervical cancer advocates like Franca Eze and Malam Mujitaba are living proof that shattering glass ceilings isn't just about breaking into boardrooms. It's about breaking barriers to life-saving care for every woman, not someday, but today, because no woman should die simply because she couldn't afford to live. Mercy Frank, Gist, Nigeria.